Hi everyone, this is Ali from Rate My Placement here. So this is the last session of the day, last presentation of the day, and it's with great pleasure that I can introduce John from the NHS. So John is a Senior Manager for Attraction and Recruitment and is going to be talking about We Are the NHS. So John, over to you.
Thanks, Ali. Fantastic introductions. I'm very excited to be here to speak to you all today. So as Ali said, my name is John Finnegan and I'm a Senior Manager for Attraction and Recruitment for the NHS Graduate Manager Training Scheme. And what I'm going to talk to you today is a bit about the NHS, a bit about who we are, which I'm sure most of you know who we are, but just give you a bit more of an insight to how we're broken down. A bit about our values and our purpose, about what we're trying to do at the moment. And then more about the actual grad scheme itself, which our applications are open at the moment. So I'll go into a bit more about the recruitment process, also the support available and the sort of career path that people take as they go through the grad scheme. So I'll just move on to the next slide for you all. So a bit about the NHS. Now, I'm sure all of you are glued to your television boxes at the moment about what's going on in the outside world. And probably more so than ever, the NHS has probably come to the forefront of people's minds and experiences at the moment. But actually, what's really outstanding is the NHS was formed in 1948, and the grad scheme has actually been running for 62 of those 72 years. So very experienced in what we do, very successful in what we do as well. And we're currently fourth in the Times Top 100 grad schemes in the country. Just gives you an idea of where we are. In terms of occupations for the NHS, what you probably see on the news, and it's always in people's minds and thoughts, is clinical staff. So that's nurses, doctors, and medical staff, AHPs, physios. But actually, there are over 350 different occupations in the NHS. And we tie that back to the actual grad scheme, and your career path actually opens up really, really broadly for you. Makes the NHS a place where people come, they stay, and actually prosper when they're in the NHS as well. Bit about delivery and operationally. So every 36 hours, we see 1 million patients. So by the time you're having your breakfast on Friday, there's been over 1 million patients seen and cared for in some shape or form. How the NHS is split is over 8,000 separate organisations. I think that's really interesting for you all on the call that probably want to know about the NHS, because you probably see the big brand everywhere. People have a pull towards it. They know what it is. But actually, that is broken down separately into various separate organisations. And they range from trusts, so acute trusts, so where those A&E departments take place, ambulance services, which are self-explanatory, clinical commissioning groups, so actually put the policies forward for the NHS, arms length bodies, such as NHS England, primary care networks, community healthcare trusts. It goes on and on. There are so many different organisations that are involved in the NHS. And we tie that back to the different occupations. If you were going to join the NHS, you could end up in a various occupation in a different organisation, and that career path can be as broad and as wide as you want it to be. In terms of the budget, we just have over 100 billion. Well, I say just have over 100 billion pounds budget every single year aligned to the NHS and its delivery, and also the strategy of moving it forward. So I want to focus on this slide for a second, just because we see the NHS as a big brand. We think we know what it does, but actually it's broken down to many different things. So if you come to join the NHS, you can end up anywhere and be anything you want to be. Now, a bit about our values and challenges. And the reason why I put this slide up, I want to share this with you, is very important, really. And thinking about the team that I'm part of, and that's Attraction Recruitment in the grad scheme, we have many disagreements. We challenge each other, we fall out, we make up, we debate. It goes on and on a day-to-day basis. But there's one thing that brings us all together on a day-to-day basis to actually improve the NHS, and that is these values here on this slide. Every decision that we make is we are working together for patients. So yes, I'm part of the office. Yes, I'm not frontline care, but the decisions that we take do have a support and do have an enabling factor on patients down the line. Yes, we challenge and debate, and we fall out and we make back up again, but we do that in a respectful and dignified way of actually making things better in the NHS as well. We have a commitment to quality of care, and that's everything that we do. We are compassionate in how we work and how we treat each other. We join the NHS to improve lives, and we have a value also that everybody counts. So no matter if you are a chief executive of a trust, you are starting your career in the NHS, or you want to take a different career path that hasn't been tried before, everybody's counts and everyone's voice counts. And what we say about the NHS is, no matter who you are and what your background is, who you represent, you can join the NHS, be yourself, and make a real difference to people's lives. So that's really thing to keep in mind as I move through this presentation for you. Then challenges, I put some there for you, but I'm probably aware that you probably are all aware of the challenges going on in the country at the moment. Obviously the coronavirus and global pandemic. So that's a big issue that the NHS is fighting at the moment. We do have our challenges within those, and they sometimes are in the news. Sometimes they go too far. Sometimes they are actually detrimental to our success. But we are transparent about those. We are open about those challenges. And that means that when people come to join us, they can also be open about their development and their feedback and how they want to move their career forward as well. And sort of the two things I want to pull out of this sort of slide at the bottom in challenges is the NHS long-term plan and the NHS people plan. Now, the NHS long-term plan is the plan to take the NHS forward over the next 10 years into the 21st century. So no longer can the NHS be a reactive service that actually tackles people's health issues, but actually needs to be proactive and also manage people's health as they grow older and make sure they have the right care that is needed. So that's a different shift, a different culture of how the NHS has currently been for the past 60, 70 years. And the NHS people plan is the plan that's going to support our people and staff, our 1.3 million staff in the NHS to bring forward that NHS long-term plan. But have a look at those online, and that gives you more insights about what we're trying to do over the next 10 years as a whole, and how we can look after our people in the NHS as well. So a bit about GMTS, about what it offers. So GMTS is a fast-track leadership scheme, and it's been running for, as I said before, over 60 years. We are a 2-year scheme, 2.5 years if you want to do finance. And to give you an idea of the kind of success that has gone on in the graduate manager training scheme in the NHS, 4 of the last 5 NHS chief execs are alumni. So if you remember the NHS briefings that happened quite a bit in March, April, May, you probably might have seen this gentleman on the news, and his name is Simon Stevens, and he's the Chief Executive Officer of NHS. He came through the grad scheme, and now he's gone on to be Chief Exec of NHS England. All that shows is that the career path can be as high as you want. It can be as low as you want, or it can be actually varied. It can be whatever you want it to be. But gives you an idea. If you want to go to reach the top, the scheme is there. We'll give you the tools and development and the resource to do that. So what do we offer? Now, we offer challenging work placements to meet competency profiles. So what that means is everyone who joins the scheme will go on at least 2 placements in different organisations, different teams, to work on various projects, resources, support, all that kind of stuff to support frontline care. Everyone who joins the scheme will go on a flexi placement. And this is a really big pull for the scheme. And this is the opportunity for you as a candidate or a trainee to go outside the NHS if you wish, go to a big accountancy firm, as you can see here, KPMG, Deloitte, learn what they do, work with those, and bring that resource and that skill set and that knowledge back to the NHS to make a real difference. In terms of flexi placement, that could be put in social care, local authority, it could be accountancy, it could be in law. We'll work with you to ensure that the flexi placement is fit for purpose and meets your competency profiles. But that is a big pull for the scheme, and it's something that we really want people to go and actually develop themselves outside the NHS. We also offer action learning sets, so working in small groups to support and challenge one another's learning and development. So when you join the scheme, you'll be part of a cohort, and you'll work together and support each other through those bits and pieces that you need to get through the scheme. We have experiential learning, so that's the way we develop leadership behaviours, knowledge, attitudes and skills. And we also have education and mentoring support. So everybody on the scheme will go through a healthcare leadership qualification, and also some schemes of the graduate manager training scheme offer additional professional qualifications as well. So for instance, finance, you'll be put through a SITFA qualification, and that's to give you again the support, the tools to be a success on the scheme, but also in the NHS in your career. So there are 6 specialism areas that we have currently open at the moment where you can apply via our website. The first one is general management. There's finance, human resources, health informatics, health analysis, and policy and strategy. Now, what I would say is when you're going to pick one of these specialism areas, think about what you're passionate about. We're not looking for experience. We're not looking for a time you can do this or you said you've done that. It's more about your potential, your passion, and how you make a real difference in the NHS. So if your passion is not numbers and it's not finance, don't put finance down. Very simple. Put general management down or something else. It's about finding out what you want to do in your career and for those 2 years that you're on the scheme as well. Now, in terms of policy and strategy, at this moment in time, that specialism is now shut as we've been oversubscribed for it, but the other 5 are still open. And if you're unsure about what to go for, I'd put general management. That's a good all-rounder. Now, before I move on to the next slide, I would say that these aren't tied down for your career. So if you wanted to put finance and you actually thought after 2 years, I really enjoyed finance, it is my passion, I really got what I needed, but I feel like I want to move into more of a service manager role or a business manager role, you can do that. There are plenty of opportunities to do that and examples of that. So we have an exec director of a trust in Royal Surrey who came on and did HR. They went to do transformation. They did operations, and now they are a director of strategy. So your career can be whatever it wants to be. So just to highlight again, all trainees complete a postgrad certificate in healthcare leadership, and that is done through the National Leadership Academy in Leeds, and that's the Elizabeth Garrett Anderson programme. So you'll all go through that to give you the tools you need to be a future leader in the NHS. And then every specialism here has its own sort of PG or postgraduate certificate as well. And there's more information about these on the website about what you'd go through and the sort of time commitments and support that's in place for you as well. So GMTS, is it for everybody? So first of all, I would say it's no ordinary leadership scheme. It's been around for over 60 years, as I've said. It is a fast-track leadership scheme. And the things you will do on the scheme is you will come across fascinating situations you've never had before. So we have a cohort currently going through the scheme at the moment, who most of them have been deployed to COVID-19 work. So some of them have gone to Nightingale hospitals in Harrogate and in London. Some have supported A&E support as well. So you will, when you join the NHS, you could end up doing a lot of different things you'd never be able to do before, or people before you or after you will never be able to do before as well. So it is a fascinating place to be and a really good opportunity to actually enjoy the NHS and get into different bits of work. And also as well, you'll see the way the NHS works to support and care for patients. So there's loads of opportunities to get involved to support care. You might be based in NHS England, an almost body where you can focus on maybe improving finance, but you will have an effect on patient care later down the line, definitely. And all, like I said before, when our values come together, it's how we always challenge each other, we debate, we fall out, we make back up to make sure that the best decisions are made for patient care. So that's what you will get on the scheme. Now, GMTS is hard. I'm not going to lie to you. So you'll have hard work. So it is a full-time job. But alongside that, you will have academic and professional studies to do. So I've already mentioned that most of you probably go through 2 qualifications. That is hard going. And I'll come on to support about that in a second, but that is tough for most graduates. It's emotionally demanding. So it is a roller coaster. You will have ups, you will have downs. But when people complete the scheme, they think, what an amazing opportunity that was, an experience that I gained throughout the scheme. It is challenging. And like I said, it is rewarding. And for those who've got what it takes, who want to make a difference, who want to show that they can make a difference to the NHS, they have the same values as us, they will prosper in this scheme and they will stay with the NHS for a long time and make real difference moving forward. So key information, just to go through, that you can see about the scheme. All this information is on our website, but just to go through the key sort of bits and pieces. You'll do on-the-job training and experience. So you could be based at many different places in the NHS, but you'll all be working towards the same competencies. So every placement is different, but it's the same competencies you'll be working towards. You have an academic postgrad level qualification that you're working towards, which I've got into. You'll have 2 to 3 placements. So these are the 2 placements in the NHS and also the flexi placement, which is outside the NHS as well. Duration. So most of you will do 2 years, but finance is 2.5 years at the moment. So you're willing to stay with us for an extra 6 months, I'd probably say go and do finance. And then benefits, you can see a salary there, the kind of annual leave that we offer, the pension. And if you are part of the NHS in some shape or form at the moment, we do offer protected pay for in-service staff as well, if you're already part of the NHS. So recruitment selection, and this is open at the moment in time. So if you go to our website, you can start applying for the scheme, which I welcome you to do so. First of all, we ask for a 2-2 degree in any subject, so any discipline. So we've had many examples of people doing history, geography, some subjects not really knowing what they want to do with their careers. We do take those. So think about your degree, think about what that offers, and then come forward, and we'll accept that as a 2-2. You'll need legal permission to work in the UK. There is more information about entry requirements on our website, but you will need legal permission to work in the UK. And trainees can be placed anywhere in England. So what we do say is, we do often say, can you put your 3 preferred working regions down? But we will try and place you in those regions, but it could be that you placed anywhere in the country as where the supply and demand is needed in the NHS. So quick process about what you go through. So Match Me tool, so go to our website, there's a quick Match Me tool you can do to see if the scheme is right for you. This doesn't go towards your assessment, just more of a self-assessment for yourselves. I'd advise doing that before moving forward. Gives you the idea of, do my values meet with the NHS? Can I make a difference? Is this a scheme for me? If it's yes, I'd welcome you to go and do your online application. This is a bog standard application, really. Name, address, telephone, what you're interested in, all that kind of stuff you've probably done before when applying for jobs or when applying for universities. After that, you'll complete 5 online tests, and these include numerical reasoning tests. They include a personality profiler, a strengths test. Before you go on to the online tests, you will be offered a chance to actually try those out, and also a chance to actually go on Google and try those out as well. So if you get worried about the online tests, then it'll have to be completed one after the other. You can take breaks, and there's plenty of time to practice as well. After that, you'll be asked to do a video interview. So like what I'm talking to you now through a laptop, you'll be asked to just answer maybe 7 or 8 questions at a video interview, which will then be later scored. And then if you finally pass that, you'll come to our virtual assessment centres. Now, we ran our first virtual assessment centres back in September, and they were a great success. So we had 250 candidates go through those virtual assessment centres to start the scheme in March 2021. Our first assessment centres virtually delivered for September 2021 will take place in December of this year, and they'll carry on to May of next year. So you'll be invited to one of those. And then we are taking up to 500 trainees to join the scheme in an intake in September and in March 2022, which seems quite far off. So there is up to 500 places for candidates who come through. And what that means is you're not competing against one another. You're actually focusing on yourself, being yourself, as you come through the recruitment selection process to take one of those places up to join GMTS in September 21 or March 22. So supporting your GMTS journey. Now, I've probably gone into quite a bit about why the scheme is hard, it's difficult, and it's 2 years, which is quite full on, but there's plenty of support for you when you join the scheme. So first of all, there's host organisations. So like I said, you could be based in a CCG, a primary care network, an integrated care system, a acute trust. There will be placements and programme managers in those host organisations that will support you through your journey. And that's to meet your competencies, to make sure you pass the scheme at the end of the day. There's also a local leadership academy. So every region, so the country's split up to 7 regions, and every region has a local leadership academy, and they're in there to support you and support your placement, make sure it's fit for purpose, make sure it's saying what it should have done, to ensure you have the support needed to get you through your journey on the scheme as well. I've mentioned programme and placement managers, but you also have a regional training support manager, which you'll be allocated. And this is more about your health and well-being. So we know that people go through really ups and downs on the scheme, not only on the professional side, but also their personal lives as well. And the regional training support manager is there to support you from a pastoral care as well. So any issues you have, they are there to support you. You'll have a mentor and a buddy, and that's about your own personal development and your career, and ask any sort of practical questions you have, and they'll be allocated to you when you start as well. And you also have the Higher Education Institute that you'll be part of. So most of you will be going through a postgrad certificate at a Higher Education Institute. The training and support will be there for you, as well as will be the National Academy as well. So key information before I hand back to Ali to take any questions from you. The NHS grad scheme is a leading leadership development programme, and it's been run for over 60 years. We're very experienced at what we do, and we're fourth in the Times Top 100. It's a really, really fantastic scheme to be part of. Most specialisms, apart from finance, are 2 years with direct experience, some on the front line, some behind the front line, but also with that mantle of improving patient care. You will all go through professional academic qualifications, which I've mentioned. When you join the scheme, you're there for 2 years, and there will be support for you finding your next role after the scheme as well. So it's really important that we actually give you that support to break from the scheme and go into another role in the NHS to make a real difference in that role as well. So that support is there, and that's done from the regional training support manager, but also placement and programme managers as well. For NHS staff, there's protected pay and leave for in-service. What we do ask is from an application point of view, if you do one application in a 12-month period, so if you applied this time last year, you're good to go. If you apply now and unfortunately you don't get through the online tests, we ask you to just wait a year and maybe develop yourself before you come back. Applications are open at the moment in time. They've been open since the 12th of October. And they'll be closing some point in December. So we've had absolutely fantastic response in terms of applications coming forward from you. So I'd say if you want to join, get your application in as quickly as possible, as we could be shutting early this year rather than the December 18th number that you probably see on the website. And that website there is where applications are online, and you can only apply online. So I'd welcome you to, after this call, after this event today, check out our website, go in there in the application form and just pop in your details and start the application process off. And we can start communicating with you about next steps when you get through that application process. And that's in the slide. So I'll hand back to Ali for any questions you've got, Ali, that people have got. I'm happy to answer those.
Thanks so much, John. That was really insightful, and really appreciate the detail you went into. You'll be pleased to know we've had plenty of questions coming through, and most of them seem like they're people who are really interested in applying as well. So hopefully that you'll get a flood of applications coming in. So I'll just go through the list and ask the ones that are on here, some of which you might have covered in some sort of depth, but it's always good to get clarification on some of these things, I think. So first up, thank you so much, Lisa, for your question. So she's asking, is the scheme flexible to allow people that need to work from home due to health and disability? And then how will the placements that you talked about work in that respect?
Yeah, it's a really great question, actually. And I'll probably take it a back step first and answer the question about probably diversity and how important it is to the NHS. So there's a lot of research done, and it's in the long-term plan and people plan that actually diversity needs to be a real key part of how the NHS works. There's lots of research to say that if the NHS staff is representative of the population that we serve, as in the people of the community, those people and those patients will get a better service back from staff and also the NHS. Now, take that forward into the sort of the scheme itself. The short answer to you is yes. So anybody who puts forward, they have special circumstances. So that'll be disability, they are a carer, they have mortgage, they have a family. We will honour those, and if you are tied to a certain region, we'll try our utmost to place you in that region that you want, that you come forward with. So that gives you a bit of peace of mind about that. In terms of the question you asked about if you started the scheme, the answer is yes. If you start the scheme and you need to work from home, whether it be for medical reasons or whether it be for carer or any reason whatsoever, we would work with you to ensure that you have the same experience as others on the cohort you start with, but you can do that from home and the safety of your own home in these challenging times. So in terms of the placements, so if you're based in sort of a trust or a frontline care setting, there are some various people on the scheme now that are actually still working from home, and to make sure they get that safety from working from home. In terms of your flexi placement, we'd work with your flexi placement organisation to ensure that's still the case as well. Now, we are hoping that with all the positive news at the moment about potential vaccine coming forward, that by the time you start scheme September 2021, all the sort of working from home stuff might have changed, but we'll still honour your preferences and your health and well-being above anything else on the scheme. So I hope hopefully that answers your question for you.
Yeah, great. Thanks. I'm really keen to, so I might come back and ask some questions about the whole working from home and how that's impacted things over the last 7 or 8 months. We might come back to that, but I'll ask the questions from the students. So Emma has talked about, I think she's obviously got some hints that the application might be closing early if you're fully subscribed. I think you briefly touched on that. Yeah, is there a date in mind as to when the application might close if you get your applications in?
Yeah, so it's a really good question. So there's no date at the moment, and the reason why that is because we want to give people the opportunity to get an application in. So a lot of people who probably can't attend events like this, who don't have the internet access, need to go to a library or they need to go to a friend's house to actually apply. They need time to do that. So there's no date at the moment. We're just trying to keep that open as long as possible. But what I would say is if you're already interested, as long as you start the application form and you're in our system and you're in the application process, that is fine. You are in. And if we do close, you are in and we can progress your application. Those people who are waiting to probably look at the website a bit more and see what the scheme's got to offer, do not worry. We won't close tomorrow. We'd probably do quite a bit of comms and marketing to tell you we're going to be closing in maybe a week or two. So you've got a bit of time to sort out if you want to put an application in, find a bit more about the scheme. So do not worry there as well. But no, there's no fixed date at the moment.
Cool. Thanks, John. But get in as quickly as possible, at least make a start on it. Question about international opportunities, as in for international students coming to the UK. So you mentioned that you need legal permission to work in the UK. So any more clarity on how that would work, especially, I guess, with Brexit looming?
Yeah, so the magic word that is Brexit. Well, not magic, is it? Joe, I should have known this question was coming about Brexit, really. So on our website, there's about entry requirements from an international perspective. You will need a visa 2 or visa 4 to come in and work for the scheme, and that'll have to be in place before you start the scheme. So a number of you might already have that. If you don't have that at this moment in time, it's up to you to try and get that in place before you join the scheme. Now, we do offer a small amount of candidates a sponsorship opportunity to actually come onto the scheme. And also due to that and due to the salary sort of issues and challenges there, you will be based in London. But there's more information about that on our website about how you want to come onto the scheme. In terms of Brexit, or what's around the corner on the 1st of January, I'm going to put my hands up. Put my hands up and say, I don't know the answer to that. And I think if anybody knew the answer to that, well, yes, I don't think anybody knows the answer to that, really. So yeah, I would stay close to our comms, close to our website, as we will try and update that as quickly as possible, what that would look like. But unfortunately, I don't know what the answer is to that. I'm sorry.
Yeah, I'm really putting you on the spot with quite a lot's happened in 2020, hasn't it? So quite a few things to contend with. Great question from Nima. So Nima's asking, would you be able to tell us what experience and skills you'd be looking for in your ideal candidate?
Yeah, so this is a question we always get asked when we do events and careers fairs. And the short answer is we're not looking for any experience whatsoever at this moment in time. The reason why is because it's about potential. It's about looking at you and can you come in? Do you have what we're looking for? And can we sort of shape and mold you? Not taking away who you are, but can we shape and mold you to be a future leader in the NHS? So what you'll find is when you go through the application process, there are no questions such as, tell me about a time you've done this, which is more of a sort of traditional sort of interview question about competencies, about showing you've done it in the past and actually how can you transfer that skill over to do it in the future. So we don't ask any of that. It's all about you. It's all about how you behave, all about your values, all about your motivation, your drivers, and why you want to join the scheme and what you can bring to the scheme, as in what you think it should be. It's not about experience. So if you are worried about lack of experience, do not be. Please come forward and apply, and you'll be assessed on your values and motivation only. And also, we get asked a question about, does it matter if I've graduated today or 15 years ago? And it doesn't. It's not based on experience. So if you graduated today, that's great, you can apply. But if you graduated 20 years ago, then you can also apply as well. It's about what you can bring to the scheme and the NHS, not about your experience.
Awesome. So open. That's great. So Iona I'm guessing is a second year student, and you've mainly talked about graduate roles. So is there anything that second year students can apply for? And if not, what can they do to help get their foot in the door?
Yes. So I'm guessing if this person's a second year student, let me think. No, they might not have just passed or graduated by the time they'll be able to apply to the scheme. So unfortunately, at the moment, we don't offer any sort of pathway or internship opportunity in the NHS. That's something we are looking at behind the scenes, as we do know that a lot of people still want to get involved in the NHS at an earlier stage, whether it be actually further education and also higher education as well. So unfortunately, we don't offer that. What I would say would be you probably can't apply until starting in September 2022. The positive is we know we're going to have a grad scheme because we've had it for 62 years before. Keep an eye on our website and our comms and our Twitter as we do activity around the whole year about how you can get involved. And if anything does change on sort of a pathway or getting involved in the NHS, we will be the first to let you know. But yeah, unfortunately, at this point in time, we don't have anything.
Okay, good. And then that might be related to a question from Emily. So Emily's nice and keen, and we love that, Emily. So she's interested in applying in March 2022. So again, what's the advice there?
So March 2022, first thing I'd advise would be don't apply now, because if you can't join the scheme in September 2021, you'll have to wait 12 months to apply again. If you wanted to get to know a bit about the NHS, and I do say this as in, if you wanted to gain a bit of experience about the NHS, how it works, not experience to take forward into your application, go to NHS Jobs. There are plenty of opportunities for you to get some experience there. On various roles. So I advise doing that. In terms of preparation for yourself for March 2022 and that application process, that'll probably open up in the summer of next year for you to apply for that intake. Can't see the application process changing a lot between now and then. So just get to grips with what the application process looks like. Use the Match Me tool to see if actually the scheme is for you. We do run our own webinars with trainees and alumni on it. So you might be able to learn a bit from them about how they've experienced the scheme and also what their career path is like. And just take the time to really think, is this right for me? Or do I feel like I should go somewhere else with my career? But you've got a lot of reflection time. So I'd probably say take the time to think about what you want to do and where you want to be.
Great. Use that time wisely. Yeah, it's so good you're thinking about these things early. And I think a couple of clarifications from a couple of people listening. So just clarification that the September 21 scheme is now open. So that's the start date for the one you're referring to, isn't it?
That is, yes. So if you apply now, you'll be starting in September 2021.
Great. And Zoe asks, apparently her earphones cut out. That happens with tech. So she asks, which of the schemes you mentioned is the one that's oversubscribed?
Yes, so if you want to apply now and you go through the application process, policy and strategy is no longer an option. So you can't pick that on your application form. So unfortunately, we've been oversubscribed for that one. We've got absolutely inundated with policy and strategy, probably because people want to make a difference in the NHS and make it the best it probably could be. So unfortunately, that one's off the table at the moment. If you're, like I said, if you're unsure about what you want to do, but you still want to come to the NHS, I'll probably put general management, as you could still end up in a strategy placement and a policy placement, but also you'd maybe work on a service manager placement as well. So I'd put general management if I was you.
Nice, great. And then Richard and Kasturi have asked some really good questions about their specific situation. So Richard and Kasturi, I'd recommend going to the booth afterwards and asking John about those. But yeah, so I'm just keen to know, you're obviously working from home at the moment, and we've all had to adapt quite a lot. So how has the onboarding adapted to what is going on in the world at the moment?
The onboarding of graduates.
Oh yeah, the onboarding of graduates. Yeah.
Yeah. So it's quite challenging. So I'll go into a bit of my personal circumstance at the moment. So I'm working from home. It's been the same since March. It's been tough and challenging for most people. The blend, I'm sure people who experience the same, whether it be university or yourself, Ali, who are also working, the work-life sort of balance has been quite blended at the moment. So one day sort of rolls into another. So it is quite difficult at the moment. Now, in terms of your experience on the grad scheme, if you were successful, onboarding for September 2021, we are planning it to be a virtual onboarding, just because we don't know where we're going to be coming into those months or years rather. And it looks like at the moment, people who are starting the scheme in March 2021, they'll be doing an induction orientation virtual. So they'll be doing their 20-day induction and orientation virtually at home as well, with probably a number of their placements being at home as well. So that's been really, really challenging about the onboarding process. However, we are planning that way in September 2021, but things could change. There is murmurs of vaccines and murmurs of positivity coming out in the news at the moment. So it could be that, we changed ever so quickly to go back working from home. We could probably change quickly as going back to actually normal as business as usual. Sorry. But yeah, we are planning it to be onboarding virtually, with the 20-day induction virtual, and also probably your placements, a number of those virtual as well. But yeah, I'm afraid that's probably the way it's got to be for the time being.
Cool. Yeah, thanks for the insight there. Now, today and this event is all about making an impact and getting into a role that has made an impact. So have you got any anecdotal stories that you've heard, or maybe your own experiences yourself of people who have joined the NHS and made a real difference?
Yeah, so I've got a story about somebody, but I'll sort of share what I've been through. So I joined I've been part of the NHS for a number of years, but I joined the scheme in April of this year. I didn't start this role in April of this year. I was deployed to COVID-19 work. So I was deployed to getting people who've retired onto the 111 system. So it's a triage service that you phone up and say, I've got COVID symptoms, what should I do? And that was for a number of months. So I did that because I wanted to make a difference. It was long hours, it was weekends, but it was actually the impact of trying to do that at the time. And I'd say, there's numerous people who could probably talk about their experiences over the past sort of 6 months. People who've joined the NHS who've never taken up their normal role because they've been going to COVID-19 work. And it's not because they've been sort of dragged into it, it's because they actually want to make that real difference and make an impact about what's going on at the moment. Some see it as a once in a lifetime opportunity to actually get involved in this kind of work. But I would say people who join the scheme in March and September of next year, you have the same opportunity as well. So another example is people who came through the virtual assessment centre, the face-to-face assessment centre in March of this year. They were offered the opportunity to go and work on test and trace. So they are working on that at the moment. And it is tough work, but it's challenging work, and it's once in a lifetime work as well to make that impact and that difference. And the grad scheme is the chance to do that, more so than any, because of the flexibility in where you can be, what you can do, and also your ability to be flexible and agile towards what the work is. So many, many stories. If you go onto our website, there's probably loads you can have a look at. But yeah, it's a really exciting time in the NHS, but also challenging at the same time.
Yeah, but it's a real career you can get your teeth stuck into and make a difference. Yeah, so I mean, we're all seeing it now. We're sat on a tech platform, doing things differently. So how do you think tech has changed in the role that you're in, and I guess particularly in the graduate programs that some people might be applying to?
Yeah, so we had a face-to-face assessment centre in March 2020, and a week into that, it was postponed. It was cancelled. And it was set up in September, October as a virtual assessment centre. Now we are planning to continue those virtual assessment centres for the time being, because that is the only way we can get people onto the scheme. So that is a massive shift and a massive change about how we deliver things, how exercise is delivered online, group exercises, for instance. Obviously, you've probably been all on video calls and Teams and Zoom calls where you talk all over one another. You don't know where to come into. And there's that courtesy that's got to be put into group exercise as well when you come through the virtual assessment centre. So that's probably a big shift in the application process that we've gone through. So your first day could be with us. We haven't actually been on foot on any of our offices or on campus, or whatever you want to call it, which is challenging. In terms of how we work, I joined the team in April. I haven't met anybody face to face yet. So the running joke is, how tall is everybody? So you don't have to disclose that now, Ali, but nobody knows how tall they are. No one knows the size of their feet, for instance, because everyone's just see their faces, and you will experience the same thing. So there are challenges to this of working this way, but there are positives to it as well. And one big positive is the grad scheme is not stopping. It will continue to come on. So you need to wait till March 2022, September 22, even later. The grad scheme will be there. So get to know us a bit more, see how we work. And the technology is there for us to commit and complete our virtual assessment centres.
Awesome. I get a lot of stick for my height, so Zoom's been a great thing for me.
There you go.
Cool. So, there's so many people within the NHS as an organisation, and so many different roles that you can go into. So, I appreciate asking about a day in the life. It's going to be tricky because there's so many options. But can you just give a bit of a flavour of some of the things that people might be doing on a daily basis?
I can. How long have you got, really? So currently at the moment, the grad scheme is going as normal. So the team is currently trying to get those onboarding and those applications done. We do have a call at the moment for people to go and work on deployment to deploy the vaccine that potentially could come through in the next couple of months. So people are being deployed to that. People are still deployed to workforce planning. So you can imagine that a lot of acute trusts and trust in general, they have a lot of sickness at the moment, and it's how can we make sure that there are nurses and staff to make sure we can care for staff, care for patients coming in. There's a big push on diversity at the moment, because actually the NHS is representative of communities, but actually we're not basing on experience, we're basing on who you are and what you can bring to the roles across the whole of the NHS. There's a big drive at the moment on making the NHS the best it possibly could be for 21st century care. So as I mentioned before about how the NHS is quite reactive, and 60 years has done a fantastic job, but actually due to people living longer, having multi sort of challenges when they get older, it needs to be more about proactive healthcare. And you can see that in types of public health work around obesity, diabetes, all that kind of stuff. Shall I go on? What I would say is, and I said this right at the start, there are 350 different occupations in the NHS. Now, not every single one of those will be for you. Some of those obviously are clinical roles as well, but a lot of them aren't. But there are 8,000 plus organisations you can be involved in. So everybody has their own career path. Everyone has their own piece of work. Everyone has their own sort of chance to make a difference and a change. And that's just not my grad scheme. That's also in the NHS as well. So if you want to just get in the NHS, go to NHS jobs. There are plenty of jobs there for you to apply for. I think there's over 18,000.
Awesome. Yeah, I appreciate it's such a large organisation that you can really find your own role in it, and it's just a case of figuring out what's there and seeing it for yourself. So last question for me then, just conscious we've got a minute or so. I'm really keen to find out about the work placements. I think you called it the flexi placement as well. So actually going into an organisation. So that sounds like a really good opportunity to utilise some of the skills that you would have got and actually get some real world business and vice versa. So how does that process work? Yeah,
so the placement normally is around 2-3 months. Now it's up to you if you want where you want to go. We'll support you on that. I showed that there's KPMG, that some people have gone there. Some people go to local authorities, they go to third sector, higher education. Some people go to law firms. Normally we say, why don't you do your own research about where you want to go, but also to meet the competencies that we ask you to complete the scheme. If you're struggling with a placement and you're not quite sure where to go, there's support there behind the scenes for you to do that. We do think it's a big opportunity for you to go outside the NHS, because not only it's a chance for you to actually go and try something else, but also bring those skills back into the NHS. The NHS is a big machine. Sometimes it doesn't move as fast as it should do, and that's a challenge we're trying to face and trying to get around. But if you can learn from another company and other organisation, say we can do that a lot better, bring it back, make a difference, and you might make patient care, or you will make patient care better. So support is there for you, but the research, I'd say, go and have a look for yourselves.
Great. Thank you. Well, that was really great, John. Appreciate your time and effort putting into that. And thank you to everyone on the questions on the chat. And this is that's the last presentation of the day. So there's half an hour now of booth time. So people left in the event, I would certainly suggest going into the booths and chatting to the employers there. And I guess it's just down to me to say thank you all for joining. And this is Essential Careers one, so actually a really nice one to finish on. So thank you to all the speakers and the essential workers who have done such a great job over the last few 7 or 8 months. It's become even increasingly more obvious what contribution people make to the UK. Okay, so I'm going to go now. But thank you very much, John, and we'll hopefully catch up with you soon. And thank you everyone for joining us today.